Hello, my name is Dr. Kathy Mulcahey, and I'm an orthodontist and pediatric dentist at Valencia Smiles Orthodontics and Pediatric Dentistry. When I was growing up, I would have never expected that I would have been in healthcare because nobody in my family was. I thought I might be a teacher, but when I was in high school, I got braces. And I was really fascinated with that process. And I would go and I'd talk to the assistants and watch what the doctor was doing. And so that really got me interested in going into orthodontics. So when I finished high school and then went into college, I started looking and saying, well, is that something I could do? And it was something that it seemed like it was a possibility. So I kind of headed that direction and I kept heading that direction and then went to dental school and I went to my residency past there, and it's ended up being a career that I just really enjoyed. The orthodontics kind of came naturally because of my interest in orthodontics when I was having treatment myself. When I was in dental school, I had the opportunity during one of my rotations to work on children, and I realized that I really enjoyed relating with them, and I kind of had a knack for working with them. So when I applied to the program that was a combined program for pediatric dentistry and orthodontics, it just was a perfect fit. I think that the patient interactions are the thing that make my job so fulfilling. Being able to serve them, but then having them react, be able to interact, and because we see kids through their growing years, you get to develop relationships with the kids, relationships with their parents. That, I think, is what makes it worthwhile. One question I always get asked is, when are my braces coming off? Or when am I going to be done with my Invisalign? I think that one memory with a pediatric patient that I had early in my career is this little girl was so anxious about coming in to see me, and we had to do some fillings, and she would cry and I'd work with her and we got through them. And then at the end of the appointment, she'd still give me a hug. Well, when Mom brought her brother in, Mom told me that she was very upset that she didn't get to come to the dentist. So I love reading all sorts of things. In particular, I probably have been doing more historical, reading histories, biographies, because real people and real events are way more fascinating than made-up ones. I love walking. I love singing. I've been in choir since I was little, and that's always a chance to just express myself. Best thing is being able to serve my patients and doing it with a business partner who is one of my best friends. Staff and our care for patients, we really try to personalize the treatment for the patients and treat everyone as an individual, whether they're having an easy time or a hard time. We want them to be comfortable and confident at the dentist because we feel that's a service we can do them for a lifetime if we can help them feel good about going to the dentist.